We have access to million-dollar robotics, mapped human genomes, and satellite-guided surgery. Yet for millions of Americans, walking into a pristine, white-walled clinic feels less like finding a sanctuary and more like walking into a trap. You see it in the data: lower participation rates in clinical trials, a stark hesitation toward government health initiatives. Medical authorities frequently treat this reluctance as paranoia or a simple failure of communication. But the distance between the patient and the provider is often the result of a specific, inherited caution. This suspicion didn't appear out of nowhere. It traces back to a specific, state-sponsored breach of the social contract that started in 1932. To understand the modern divide between patients and doctors, we have to look at the exact moment that trust was weaponized in Macon County, Alabama. In 1932, the United States Public Health Service arrived in Macon County to launch a new study. They recruited 600 impoverished Black men, sharecroppers and laborers living on the absolute margins of society. 399 of these men had syphilis, but the government doctors didn't tell them that. Instead, they built an elaborate illusion, diagnosing the men with a fabricated ailment they called bad blood. To keep the men coming back for observations, researchers offered meager but life-changing economic incentives: hot meals on examination days, free checkups, and the promise of burial insurance to spare their families from debt. The most effective tool the medical establishment had was a local Black public health nurse named Eunice Rivers. She was the bridge to the community, the trusted face that ensured the men remained compliant with the doctor's orders. Those orders rarely involved actual medicine. While the men believed they were being cured, they were given placebos, aspirin and iron tonic. The researchers simply watched and recorded how the disease ravaged their bodies over time. The federal government had successfully turned a vulnerable population into a living laboratory, systematically prioritizing the collection of medical data over human life. In 1947, penicillin became the widely accepted, highly effective cure for syphilis. The disease no longer had to be a death sentence. Researchers withheld the treatment from the participants. They even sent lists of the men's names to local physicians and military draft boards, ensuring that no one else in the medical community would accidentally provide them with the cure. This deliberate denial of care continued quietly until the late 1960s, when a public health worker named Peter Buxtun stumbled onto the ongoing study. Buxtun spent 7 years fighting a brick wall of bureaucratic inertia. He filed protests and sent letters, only to face administrators who continually defended the scientific value of keeping the men sick. Realizing the internal channels were rigged, Buxtun finally bypassed the establishment entirely. In 1972, he leaked the story to the press, forcing a national confrontation. After 40 years of internal silence, the study collapsed only because Buxton's leak forced the Public Health Service to face the scrutiny of the national news. By the time the study was terminated, 128 men had died of syphilis or its complications, 40 wives had been infected, and 19 children were born with the disease. The resulting public outrage reached Washington. Congress passed the National Research Act, creating strict regulatory boards to prevent researchers from ever exploiting human subjects like this again. This led directly to the Belmont Report, which established 3 foundational rules for modern medical ethics: respect for a person's autonomy, beneficence to maximize benefits and minimize harm, and justice in how subjects are selected. It took until 1997 for President Clinton to issue a formal apology to the remaining survivors, putting the profound moral failure of the United States government on the official record. The laws have evolved and regulations are stricter now, but the psychological scars remain. Institutional trust takes centuries to build, and only one lie to destroy.